One of the questions that we also get from patients is, hey, I have back pain and somebody recommended putting cement in my back. But how crazy, right? Cement? It's not that kind of cement. It's not the stuff that we use on your house. This is very different, So first and foremost, let's talk about back pain due to vertebral fractures.
Vertebral compression fractures are the most common type of fracture affecting the spine. They cause the main section of each vertebra, called a vertebral body, to collapse in height. Compression fractures are often the result of osteoporosis, a type of bone-thinning disease that most often affects older women, particularly those who are past menopause. Osteoporosis is characterized by loss of bone mass and structural deterioration of bone tissue over time. This makes the bone fragile and increases the risk of fractures.
Vertebral fractures can be broken down into two different categories. They're pathologic, they can be osteoporotic, or they can be just from traumatic injuries. Now, if you have a hard fall, it is likely that you broke a fracture or you broke a bone in your back. That is very feasible, and that may be very normal if you had a pretty hard fall or a hard injury. But if you had a very subtle injury and you broke a fracture into your back or into one of the vertebral bodies of your spine, then this should be concerning because you may have another underlying condition. And those underlying conditions could be osteoporosis, where you have weakened bone. It could be from a metabolic disease. It could be from cancer. And understanding which one it is makes a difference in your treatment plan. For vertebral fractures, there are many different treatment options. Commonly, we can break it down into a few different categories. The first is bracing, which is conservative treatment, and you need a very specific type of brace in order to limit movement in this area. And the vast majority of patients tend to do well with bracing. So if you're ever diagnosed with a vertebral fracture, come to us for a second opinion to make sure you have the correct brace and that you have tried and failed conservative options before seeking more aggressive options. Another option is what we call vertebroplasty or kyphoplasty. They're similar procedures, not the same, but similar. At Carolina's Pain Center, we usually stick with kyphoplasty. There are pros and cons between vertebroplasty and kyphoplasty, and we would love to have this discussion with you in person and explain to you why we choose kyphoplasty over vertebroplasty. In addition to that, kyphoplasty is not for everybody. Like I said, a large subset of these patients with vertebral fractures get better with conservative treatment. Conservative treatment is bracing. If you've tried and failed bracing and you're considering kyphoplasty, let us know and we can help guide you to the correct answer. Kyphoplasty is basically a procedure where we take a needle, we put it into the vertebral body of your spine, and through it we place a balloon that allows us to create a cavity inside the bone so we can inject cement into this. This is a very specific medical grade cement that we can place in there. They will help limit movement of bone in this area and give you very quick relief of pain associated with vertebral fractures. Now, there are other things we can do also, and there's other benefits of kyphoplasty that we can review in person also. We would love to have this discussion for you, and we would love to help you with your back fractures if you have any. If you are seeking any kind of professional help with this, please understand that there are options. Some of these are conservative options that most people have usually not tried, but a large subset of these patients are very successful with conservative options. Please call us, let us help you make good decisions, and let us see if we can treat your back fracture in a conservative way.